This is the post-operative scan of the same patient. It was carried out on 26th of June 2023. Now just see the distended stomach here. Although patient was fasting for the last 12 hours, but significant amount of food residues, they are still present in the residual stomach. Partial gastrectomy was done and gastrojejunostomy was carried out. Patient now presented with persistent vomiting. Now just see the site of anastomosis here. There is narrowing, resulting in gastric outlet obstruction. Now another finding, please just observe this thickening of wall of the central part of the transverse colon. This is the proximal part of the transverse colon. Now this is the distal part of the transverse colon. Although lumen appears narrowed, but there are no obstructive signs in the transverse colon and the ascending colon. The patient was given chemotherapy but couldn't sustain it, so the patient received 28 doses of radiotherapy. So these findings in the transverse colon, and please also observe the thickening of the anterior abdominal wall. Transverse colon is adherent to the posterior surface of anterior abdominal wall here. These all represent the effects of radiotherapy. These do not represent the metastatic lesions. Although the thickening of anterior abdominal wall is unusual, so the possibility of metastatic lesion in the anterior abdominal wall cannot be excluded, but since rest of the findings like thickening of the or increased density of the upper part of the greater omentum is there, this one here, so most probably these all represent the effects of radiotherapy and not the residual disease or the metastatic lesions. The patient has developed mild ascites. These are the gallbladder calculi here. Bilateral simple renal cyst. Again ascites here.